Did your doctor mention about this? Yes, I'm talking about advanced anti-obesity medications. Or maybe the term they used is dual pathway therapy for obesity and diabetes. Hi, I'm Dr. Swati, and today we will discuss all the buzz around advanced anti-obesity medications or dual pathway therapy. So get all your concerns in place. Is this even safe for women? Will this affect my periods? What if I want to get pregnant later? Will I be stuck on the injections forever? Or is this just another weight loss gimmick? So let me just walk you through exactly what these medications are, who they actually help, and what you should realistically expect in plain language with specific attention to women's health concerns. So first, let us understand what these medications are actually doing inside your body. After you eat food and the nutrients enter the gut, two really important hormones are produced by the gut. The first one is GIP, glucose dependent insulinotropic polypeptide. What it does is, as the name suggests, it signals to your pancreas to release insulin, telling that food has come in. The second one is GLP-1, that is glucagon like peptide 1. This one slows your digestion, tells your brain that you are full. In other words, it sends satiety signals to the brain and helps keep your blood sugars in check. Now here is something where it gets interesting. In conditions like obesity, PCOS, diabetes, which honestly a huge number of Indian women are dealing with, the body reduces the response to these signals. Your brain just cannot hear your full message anymore. Your pancreas struggles to control sugar efficiently and your insulin resistance just keeps getting worse. So what these newer anti-obesity medications do is they work through what is called a dual pathway. They activate both hormone receptors, the GIP pathway and the GLP-1 pathway at the same time. So let's understand how these medications work once they enter our system. First thing is they act on our brain and they suppress the appetite centers. In other words, the brain starts getting signal of fullness quite early. That is how you end up eating less. Not because you're forcing yourself to starve. It becomes effortless. You just feel full and you don't want to eat any longer. Second, they work on our gut, and the way they work is they reduce the distension of the stomach and they reduce the emptying time of the stomach, so you feel full even after eating half of the portion that you usually eat. Third, they act on our pancreas and they better the natural insulin secretion. As a result, people who have diabetes, sugars start getting controlled even before weight loss starts. For people who have PCOS, the insulin pattern improves, and that's how it works perfectly the way it should work. One more thing that is critical to understand is that these medications work best when they are a part of complete lifestyle transformation program. That means working with a nutritionist, committing to physical activity that is right for your fitness level, managing stress and getting proper sleep. These two aspects are often overlooked in many programs. These are very important. The medication supports that journey and does not replace it. Now let me be very straight with you here. This is not an instant weight loss solution and it is definitely not some celebrity cosmetic trend. Here is what actually happens when you start. Your doctor will put you on a low dose first, and then they will gradually increase it on a regular intervals, generally 4 weekly interval, and this is what we call dose escalation, and it is specifically designed to give your body time to adjust to the medications, adjust to the side effects if there are any. The medication is taken once a week as a subcutaneous injection. That basically just means under the skin, subcutaneous. Similar to how diabetic patients take their insulin shots, it is exactly the same. After a little bit of training, it's a child's play. Everybody can take this injection, self-administer it at their home itself. And now you're probably thinking, okay, fine, but what about the risks? So let us discuss about the side effects. In the first few weeks, a lot of women experience nausea, some people experience vomiting, some people have loose motion, some people have constipation, some people have just not feeling well in the stomach. That's all. Everybody will go through these symptoms. Typically, these are taken as once a week injection. Suppose you're taking the injection on Friday, Saturday and Sunday will be a little bit heavy days when you will feel these symptoms. By the time of third or fourth day, the symptoms settle, and last 2 to 3 days absolutely nothing. In the next shot, again after 2-3 days, there will be little more of these effects, but they will still be less than what they were in the first week. Third week becomes literally 1 day symptom, and fourth week absolutely no symptoms. So this is how the body adjusts to these gastrointestinal side effects, which are very common with these medications. But the important aspect is the women who are on oral contraceptive pills. So if you are on the birth control pills, you have to discuss it with your doctors to talk about a backup contraception during those initial months where the absorption of these medications can be a little erratic. This is why medical supervision in the beginning is so very important. So the question everyone eventually asks is, what results can I actually realistically expect? So in clinical studies, when the medications are used alongside proper lifestyle changes, women experienced meaningful weight reduction over time. Whenever we talk about clinical studies, we always talk about an average weight loss that had been achieved, which with these molecules somewhere is between 20 to 22 kgs, where some people have gained within 6 months, some people have taken 1 year to achieve that weight loss. It all depends on how committed you are to the full treatment plan. Individual variations from this amount of weight loss definitely is there. Some people in our experience, for whatever reason, are very poor responders. Some people are too good responders, but an average becomes a 20 to 22 kgs of weight loss with these medications, dual pathway medications. So weight loss comes with all other advantages like improvement in waist size, improvement in blood pressure, sugars, cholesterols, and women with PCOS also experience that their menstrual cycles become regular. In people with type 2 diabetes, as I had said, that blood sugar control improves significantly when this medication obviously is paired with dietary changes and physical activity. But here is what you need to keep in mind is these changes build over months, not weeks, and they work best with proper dose adjustment, structured follow-up, balanced nutrition, and most importantly, regular movement. In other words, regular exercise. Okay, now let us talk about the serious safety points, and every woman considering this needs to hear this clearly. These medications are not suitable for everyone, and your doctor will screen you thoroughly before prescribing these medications. There are situations where you absolutely cannot take these medications, like if you're already pregnant or if you're planning to get pregnant in next few months. And even if you're currently breastfeeding, we are very cautious. If you or any of your family members has a history of a specific type of thyroid cancer called medullary thyroid cancer, this is very important. Not all thyroid cancers are contraindications here, but only medullary thyroid cancer is a concern. If you have a genetic condition called MEN2 syndrome, multiple endocrine neoplasia 2 syndrome, we absolutely won't give this medication to you. If you have any severe allergic reactions to similar medications in the past, that's a red flag for us. Apart from the usual gastrointestinal side effects, acidity related side effects, what are a concern, a serious concern with these medications are a recent reports of somebody developing pancreatitis, severe abdominal pain that you can't tolerate, you need to be admitted and get treated for that, or something what we call gastroparesis, that is so much of vomiting happens that you have again to be admitted and given treatment, a case of blood clotting problem which we call DVT, deep venous thrombosis, and some vision issues. But all these serious side effects I would put together to say they are way less than 1%. If we give to 100 people, the chances of these happening to you is less than 1 in 100. Now a lot of women come in worried that am I going to be on injections forever? Now I want you to think about it a little differently. This is a journey which lasts not for days or months or years, it is a journey of decades. This is a battle you had been fighting with yourself for decades and most of the time losing to it. This weight is not just a weight issue or a cosmetic concern, it is associated with your PCOS, it is associated with your sugar control, it is associated with a lot of other metabolic health problems. And these injections help you to reach a target weight. What is the target weight? The weight at which all your metabolic problems subside completely. Your sugars get controlled without medications, your PCOS require no further medications, your fatty liver reverses. So after achieving that kind of target weight where your health actually improves a great deal, Then the question starts, now what do? Do we stop the injection or do we continue it? For some people, if you're able to stop it and maintain the same amount of diet the way you used to be taking on these medications, very well, you can give a try for that. But if you're not, if you start feeling hungry again, it is a time to continue this as a continued pill or continued medication, not just for weight loss, but for managing PCOS, diabetes, and all other problems associated with it. And what does it take? You can take it at the privacy of your home. It's just a small prick which is absolutely painless. It takes less than 30 seconds for doing it. So this continuing the injection as a concept is not a weakness. This is you taking proper care for your metabolic condition. So here is the real thing that determines whether someone succeeds or fails with the advanced obesity therapy. It is not just taking the injection. Success is a structured follow-up. After your first dose, your doctor will likely schedule your week 4, week 8, week 12 follow-ups. At each visit, they will check how you are tolerating the medication, what side effects you are dealing with, whether the dose needs to be adjusted, how your metabolic markers are tracking, and specifically for women, how your hormonal health and menstrual regularity are responding. Here is something that does not get said enough, that many women stop treatment in the first 6 weeks, not because the medication isn't working, but because they hit temporary side effects without proper guidance and just go discouraged. That is the real dropout point. So when you go back to your endocrinologist, go prepared. Ask them these specific questions. Considering my hormonal profile, my PCOS status, my family planning situation, am I actually the right candidate for dual pathway therapy? What realistic outcomes should I be expecting in the first 12 weeks, specifically for my situation? What does a structured follow-up plan look like to manage side effects and track my progress? How will this interact with my other medications, and how might it affect my menstrual cycle? Your doctor may recommend this as a part of comprehensive metabolic care plan, which will always include lifestyle modifications along with it. Whether you take it or not, that is completely your choice. But if you do decide to go ahead, commit to doing it properly with medical oversight, realistic expectations, and structured follow-up. Because half-hearted treatment leads to discouragement and dropout. Committed treatment leads to actual results. Remember, your metabolic health deserves more than a half attempt. And one final thing, these medications require thorough medical screening, ongoing monitoring, and your genuine commitment to a sustainable lifestyle changes. They work best when they are prescribed and supervised by qualified specialists. So please consult your endocrinologist to figure out if this is medically the right approach for your specific hormonal and metabolic situation. That is it from my side. If this video helps you, then do share it with a woman who needs it more than you. And if you want to keep up with actionable advice on the stuff that actually matters, then subscribe to this channel and hit the bell icon so you don't miss the next one.